the heart responds several ways. One, it enlarges. Number two, it pumps faster. And then, well, this just says here declining muscle mass. But the first part, when he enlarges, the heart muscles thicken. The heart muscles thicken, trying to compensate, working harder, and then it enlarges. Then over time, when it can no longer compensate for the delivering of oxygen, the heart starts to weaken and decline in muscle mass, and then it thins out. And then if you have a heart attack, the muscle dies from a heart attack, then that's where you have declining muscle mass, because part of the muscles died during the heart attack. Okay? But these are the mechanisms of the heart, how the heart compensates. And I'm mentioning this because when we go to the signs and symptoms, you can pick up and remember these stuff. Now, this is what I was talking earlier, the types of heart failure. There are two types of heart failure. We call the heart failure with reduced ejection fraction, and then the other type of heart failure is with preserved ejection fraction. The more common heart failure, what we've thought of all these years, is the heart failure with reduced ejection fraction. Reduced means the heart is not pumping enough blood. Now, ejection fraction is basically the amount of blood pumped. And the fraction is just when the heart gets blood from the lungs, it goes to the ventricle. And then when it pumps blood out, that's the stroke volume. The ratio of what comes out versus what comes in is the ejection fraction. Okay? The ratio. So the higher the number, the stronger the pump. The lower the number, the weaker the pump. Okay? Because it's pumping more blood out, so the ejection fraction goes higher. Now, traditionally, this is our old concept of heart failure. It's just the reduced ejection fraction. And we'll go to the different causes, how the ejection fraction gets reduced. But it's a fancy term which is saying, number one is this is a weak heart muscle because reduced ejection fraction. Number two is preserved ejection fraction. And this is the one I was talking about earlier, where you have a normally pumping heart. So the ejection fraction is preserved. And the normal ejection fraction is over 50%. By the way, it doesn't have to be 100%. Anything above 50% ejection fraction is normal. So when you see your doctors and they tell you your ejection fraction is so and so, that's a number to keep in mind. So you can have preserved ejection fraction and still have heart failure.